So good afternoon all. My paper is on SDOCT based morphometric response of the intravitreal DEX implant for the diabetic macular edema. I am from Giridhar Aya Hospital, Kochi. So the purpose of my study was the steroids are basically used for the macular edema due to the inflammation of non-infection origin with the rapid onset and the profound initial effect. The intravitreal DEX implant is the alternative for the anti-VEGF therapy for the diabetic macular edema. So aim of our study was to evaluate the efficacy of the DEX implant on the visual acuity and the morphometric parameters on the SDOCT. So it is the retrospective study of the 42 eyes, the 11 eyes being treatment naive and the 31 being previously treated with the anti-VEGF and the laser. And at the baseline, all patients were followed up as on the basis of the SDOCT and the digital fundus autoangiography. And after that, in all subsequent visits, they were followed up on the SDOCT. And the parameters which we followed were the base correctal visual acuity, central macular thickness, largest cystoid area, SMD height, and they all were analyzed at 1, 3rd and the 6th month. The what extra this study adds is like the detailed analysis of the outer retinal layer and the inner retinal layer, that is the drill, disorganization of inner retinal layer and the ellipsoid zone, external limiting membrane, hard exudate resolution and the hyperreflective intraretinal dot reduction. So compared to the baseline, the significant improvement was noted in the best corrected visual acuity, CMT, largest cystoid area at all the visit with peak effect observed at the 1st month of the study, and the early recurrence were noted at the 3rd month and the 6th month. And the dry macula was achieved in the 33.3% of the eyes at 1 and 3rd month and 11% of the eyes at the 6th month, with the recurrence seen in 81.8% of the eyes at the 6th month. So just summarizing my results, so the CMT and the largest cystoid area showed a significant improvement throughout my study period of 6 months, whereas the best corrected visual acuity showed significant improvement at the 1st month, but it is improved at the 6th month also compared to the baseline, and the SMD height was also reduced in all the follow-up period. What extra additionally I studied is that there is the hard exudate resolution, hyperreflective dot reduction, and the statistical significant improvement in the regeneration of the external limiting membrane throughout the study period. So this is the first case where there is significant CSFT at the baseline, like 676 micrometer we can see. Following the DEX implant injection, there was a significant reduction in the hard exudate at the 1st month and 3rd month with the CSFT reduction. At the 6th month, there is a complete resolution of the hard exudate. We can see the 4th image of the SDOCT with the, and there is a CSFT increase. The magnitude was less than that of the baseline. Here is the second case we can see where at the baseline there was increase in the CSFT. Largest cystoid area was 5.36 millimeter square, and we show a significant reduction at all the study period from 0.36 to 0.1, and at the point at 3rd month there was a total resolution of the cystoid, and additionally at each visit there is a progressive regeneration in the ellipsoid zone and the external limiting membrane despite the reappearance of the fluid. Concluding my result, there was a significant BCVA improvement noted, and the CMT and the largest cystoid area also. What this study adds additionally is that the regeneration of the external limiting membrane, decrease in the hard exudation and the hyperreflective dot reduction. So in conclusion, the DEX implant shows significant improvement in the BCVA and promising anatomical outcomes of the micromorphic parameters with the reduction in the LCA and the outer retinal layer regeneration. Although the early recurrence was noted in the CSFT and the LCA at 3rd and 6th months, the quantum of the rebound edema was less compared to the baseline. Thank you.